Welcome, everyone. This webinar is about residential services, options for people with developmental disabilities and their families. My name is Steve Beha, and I am the Family Outreach and Education Coordinator for the Ohio Department of Developmental Disabilities. I want to provide just a little bit of background first before we get into the guidance and the specifics about the process. The 2019-2020 state budget contains some important changes which are designed to help inform people with developmental disabilities and their families about the residential services that exist in Ohio's system. This webinar is intended to help county boards understand these changes and be ready to implement them when the law becomes effective on October 17th, 2019. As with many things in our system, these changes should start with a conversation with the person with a developmental disability or their family member who might be assisting them through this process. Many folks are at different points in their lives searching for residential options, and there may be certain points in which we can't anticipate when they will be looking for those residential options. They may focus on their current situation and life stage, but may also find it helpful to look ahead to think about life experiences that will help move them towards their vision of a good life, which may include residential service options. The following questions represent the diverse experiences of people with developmental disabilities and their families. They include things they thought about, asked, or wished they had thought about, and their own life experience with a disability or other special health care needs. These questions are by no means required and are not intended to be all-inclusive or complete. But the hope is that they will help you get started in the conversation with general questions to keep in mind as the person with a disability or their families progress along the life course, and these questions are written to reflect a first-person perspective across the lifespan to represent the viewpoint of the person with a disability. The following are questions to consider. Where do I think I might want to live in the future? How am I learning about different living options? What kind of setting will I live in? Am I getting the opportunity to learn and practice skills I will need to live in other settings if I choose? Who will help me figure out how to rent or own a place to live? Or do I need something provided by the service system? Do I want to live with a roommate, or do I prefer to live alone? Can I afford to pay for my own living expenses? What technology or home modifications would help me be more independent in my home? What supports will I need to either continue living in my family home or move into my own place? What kind of living options do I know about or might want to try? Do I want to be in control of choosing, hiring, or firing my support staff? What skills do I need to live as independently as I like? And how do I find help when I need it? How will I be supported to have a valued role in my community? What kind of accessibility issues should I think about when choosing my living arrangement? What transportation will I use to get around in the community or to the places I need or want to go? Those are just a few of the questions that can be asked as somebody plans to move forward with residential supports. Everyone uses a variety of supports to help get through our daily lives, including using our own assets and capabilities. Most of us have people in our lives who do things for us, and vice versa. We all tap into technology, as well as businesses, organizations, and resources in the community. Even though some people may need paid services, we must remember to consider other types of support as well. People need supports to lead good lives. Using a combination of lots of different kinds of support helps to plot a trajectory towards a good life. The options and resources that follow can help families and people with disabilities think about how to work in partnership to support their vision for a good life. Again, these lists are not all-inclusive, but are some things to consider when planning out the supports that someone may need moving forward in their life. When having a conversation about residential support options, it's important to identify the personal strengths and assets that the person brings to the equation. Everything from the knowledge of how to navigate their community to what housekeeping skills that they may possess. You can also explore their skills in preparing simple meals or tasks? Or can they spend time alone or away from their family? What types of knowledge about different types of living options do they have? Relationship-based support should also be explored. What involvement does the person's parents, siblings, spouse, children, or grandparents have in their life? Are there any extended family or friends that can help explore residential options for this person? What type of roommates would the person like? Are there people that are the same age that are looking for either roommates, or are there neighbors available that can help with these options? As with everything, technology should be considered when exploring residential options. Questions about adapted living spaces, environmental technology, or remote supports might be worthwhile discussion, as well as video calling like FaceTime or Skype, and electronic reminders, all things that can be accessed through a smartphone or tablet through various applications. Community resources should also be considered. Home ownership or rental home or apartment should be part of the discussion. Are there co-ops for housing or transportation in the area? What is the likelihood that the person would be able to access public transportation? Are there neighborhood watch associations or homeowner associations that the person can be involved with in their neighborhoods or in their communities? And what other resources are available for them to access necessities such as food pantries? After other resources have been explored, then eligibility-based support should be considered. Things like an intermediate care facility or ICF-IID may be an option for the person with a disability or family to explore. Likewise, group or individual homes through HCBS waivers may also be an option to explore. Shared living is an option through Ohio's Individual Options Waiver and is also a residential option. Other eligibility-based supports could include Meals on Wheels or Section 8 housing vouchers to assist with publicly eligible programs. The previous questions and resources can be helpful for a person with a developmental disability or their families to plan for their future residential options. This information will be available in the Supporting You and Your Family section of the DODD website and can be used anytime planning is being done for future residential services. In this next part, we are going to cover the County Board guidance that was issued on October 7th, 2019. As we referenced before, the budget bill created a new section about residential services, and this section requires county boards to inform any person who inquires about residential services about the different programs offered as residential services. This includes intermediate care facilities for individuals with intellectual disabilities, or ICF-IID services, as well as home and community-based services, or HCBS. Residential services means services to individuals with developmental disabilities to provide housing, food, clothing, habilitation, staff support, and related support services necessary for the health, safety, and welfare of the individuals and the advancement of the quality of their life. There are several instances when it would be appropriate for the county board to communicate this information to people with disabilities or their families. First, information may be given when the individual and family first come in contact with the county board and request assistance. It may also be given as a part of a conversation during the waiting list assessment. Or it may happen when a person or their family's circumstance changes such that they are thinking of new residential options. A county board is expected to provide residential information when a person and or their guardian or family member specifically asks about residential services, states that they want to move, inquires about alternative places to live, or describes circumstances through conversations, interviews, or various assessments that indicate residential services should be considered and discussed. It's important to know that people with developmental disabilities or their families do not have to use specific phrases to receive this information about residential services, and there is not only one instance in time that they should receive the information. Any inquiry about residential services in any circumstance should follow the guidance issued by DODD. When a person with a developmental disability or their family or guardian inquires about residential services, the county board shall do the following. Provide the individual or family member with a copy of a pamphlet that was developed by DODD entitled Residential Options Counseling Pamphlet. This pamphlet explains both ICF IID services and HCBS waiver services, which can be accessed on the DODD website. They shall also assist the individual in accessing the ICF IID vacancy registry, which is also on DODD's website. If a person with a developmental disability or family member expresses interest in ICF IID services, the county board shall provide contact information for all ICF IIDs in that county and adjoining counties. DODD has developed a map of all ICF IIDs in the state of Ohio. The map is available on DODD's website. We recommend that you use this resource to assist people with developmental disabilities and their families in identifying nearby ICF IIDs.
Hello, my name's Debbie Hoffine. I am the Deputy Director over the Medicaid Development and Administration Division at the Ohio Department of Developmental Disabilities. And I'm taking this opportunity to share with you a little bit about how these upcoming changes are related to our current waiting list processes for home and community-based waiver services. A couple questions that have come up in different conversations pertaining to this. One being that if someone has a current unmet need and they don't wish to live in an ICF IID, can they be on the waiting list for HCBS waiver services? And the answer is yes, they can, certainly, as long as there are no other community-based alternative services that meet their needs. And that's pretty standard across the board. This really hasn't changed as a result of this particular legislation. Another question is if someone decides they would like to live in an ICF IID, do they have to have a waiting list assessment completed first? And no, they do not. Admission to an ICF IID is actually not dependent on the outcome of a waiting list assessment and whether or not there is a current unmet need. If there's an ICF IID that has a vacancy and the individual is interested in living there, they don't have to go through the waiting list assessment process. However, keep in mind there are specific level of care requirements that must be met prior to admission in an ICF IID. The waiting list assessment has been amended to require the boards to do the following things before placing someone on the waiting list. So the boards need to inform the person of the option to receive ICF IID services. They need to provide the individual with contact information for ICF IIDs in that county and also the contiguous counties. And they need to direct the individual to the ICF IID vacancy registry that's located on our DODD website. It's also important to note, even if the individual and their family have already been informed of the ICF IID option at some point throughout the process, it's important that the county board remind them of this option again immediately prior to placement on the HCBS waiting list. Also, county boards should document compliance with this particular provision in their case notes for that person. If you have additional questions or concerns regarding how these new provisions relate to the waiting list assessment process, please feel free to reach out with an email directed to wla@dodd.ohio.gov. Thank you.
Thank you for watching this webinar. All the resources referenced in the webinar are available at dodd.ohio.gov by using the search box at the top of the page. Direct links to each of the resources are also available in the description of this webinar. Thank you.